We have to form the nursing diagnosis before we be able to plot the nursing care plan. So the question goes this way: Mrs. OC, a 50 years old woman, was admitted to the female medical ward with complaints of persistent fatigue, unintentional weight loss, generalized weakness over the past 3 months. She has history of type 2 diabetes mellitus. Upon assessment, she appears thin with prominent muscle wasting, dry flaky skin. Her body mass index is 16.5 kg per meter square, and lab tests reveal low serum albumin and hemoglobin level. She reports a poor appetite and difficulty affording nutritious meal due to financial constraints. Identify 3 priority nursing diagnoses for Mrs. OC and develop a nursing care plan addressing her nutritional status. So we are going to form the nursing diagnosis. The signs and symptoms are persistent fatigue. We have unintentional weight loss. She's not doing weight loss. She has generalized weakness. So on assessment now, she also looks thin. This now denote that she's kind of having malnutrition. Diabetes now comes with muscle wasting and prominent muscle wasting. There is flanky skin. The BMI is 16.5. So the lab test now reviews low serum albumin, low hemoglobin level. There is poor appetite also. So we have subjective data here and we have objective data. And she cannot even afford nutritious meal. So our signs and symptoms now are persistent fatigue, unintentional weight loss, generalized weakness. She appears thin. There is prominent muscle waist. There is flaky skin. The BMI is 16.5. The lab test now reviews low serum albumin, that is low protein, and low hemoglobin level. Her blood is low. So this thing now is signs of malnutrition. Our patient here is having malnutrition. So our first nursing diagnosis now will be imbalanced nutrition. Imbalanced nutrition, because the patient is not even eating. Imbalanced nutrition, less than body requirements, less than body requirements, related to loss of appetite. You can go for loss of appetite, but the thing that is doing our patient is not even loss of appetite. She cannot even afford it. You get related to reduced dietary intake, evidence by our patient has unintentional weight loss. So evidence by weight loss. This nutrition now, the reason we put it first is that imbalanced nutrition, it affects vital organs because you need food for your body to function. It affects even the immune system. The second one is, since our patient has generalized weakness, muscle wasting, the patient will not be able to tolerate activity. So we have activity intolerance. Activity intolerance related to decreased energy level and muscle wasting. Muscle wasting, evidence by fatigue. Why this one comes second is that the weakness now can lead to complication like fall, and it can now result to another thing. So we wouldn't want that for our patient. So that is why we make it the second one. The third nursing diagnosis is risk for impaired skin integrity You know our patient has dry and flaky skin, so risk for impaired skin integrity. And if the patient falls now, it can make our patient to start having wound. So we have risk for impaired skin integrity related to the lab test now reads that the patient has low serum albumin and hemoglobin. You see it? So low protein intake, low protein intake, and poor tissue perfusion because the blood is low. So it is a risk factor. So it do not have characteristics, signs and symptoms. Now that we are done forming our nursing diagnosis, so we are going to get into clotting and nursing diagnosis.